let's embark on an exploration into the silent guardians of our body, the kidneys. These two humble, fist-sized organs tucked away beneath our ribcage are the unsung heroes of our internal ecosystem, performing complex and crucial tasks that sustain life itself. Every day, they diligently filter about 50 gallons of blood, sifting out toxins and waste, maintaining fluid and electrolyte balance, and ensuring our body functions smoothly. Yet, as robust as they appear, the kidneys are vulnerable to a stealthy foe that often goes unnoticed until it's too late: medications. As we age, our reliance on various medications increases, and while these drugs are designed to heal and protect us from illness, some harbor a dark secret: nephrotoxicity. This term might sound complex, but it simply refers to the kidney damage some medications can cause. This damage can be subtle, slowly chipping away at kidney function without clear symptoms until significant harm has occurred. Let's delve deeper into how this happens, the signs to watch for, and how you can protect these vital organs while managing your health. Imagine the kidney as a finely tuned filter, or even better, as a coffee filter. Just as a coffee filter traps the grounds and allows the liquid coffee to pass through, the kidneys filter waste from your blood, allowing clean blood to circulate back through your body. Now think about what would happen if you poured a corrosive liquid into your coffee filter. Over time, the filter would get damaged, right? This is similar to what happens when harmful medications pass through your kidneys. Among the most common medications known to cause kidney damage are certain antibiotics. These drugs are powerful allies in the fight against bacterial infections, but some, like aminoglycosides and vancomycin, can accumulate in the kidneys and impair their function. This accumulation can cause inflammation and even cellular death within the kidneys. It's not just the antibiotics themselves, but often their breakdown products that cause the damage, interfering with the kidney's ability to filter blood effectively. What's crucial here is vigilance and prevention. If you're prescribed antibiotics, it's important to discuss their necessity and potential risks with your healthcare provider. Always ensure you're adequately hydrated to help flush these medications through your kidneys more effectively. For those with existing kidney issues, or those who are frequently on antibiotics, regular monitoring of kidney function through blood tests can be a lifesaver, catching potential damage before it becomes severe. Moving beyond antibiotics, we encounter another class of medications: NSAIDs, or nonsteroidal anti-inflammatory drugs. These medications, like ibuprofen and naproxen, are staples in many medicine cabinets, used to quell pain and reduce inflammation. However, their mechanism of action can reduce blood flow to the kidneys, which, over time, can lead to reduced kidney function or even acute kidney injury. The risk is particularly high when these drugs are used frequently or at high doses. If NSAIDs are a regular part of your life, it might be time to look at alternatives. Sometimes, simple lifestyle changes, such as incorporating physical therapy, exercise, or even different pain management techniques like acupuncture or heat therapy, can reduce or eliminate your need for these drugs. Always consult with your healthcare provider before making any changes to your medication regimen, especially if you have pre-existing kidney conditions or other health issues. Diuretics are another group of medications that pose risks to kidney health. Commonly prescribed for conditions like hypertension and heart failure, diuretics help the body eliminate excess fluid by increasing urine production. However, this increased production can lead to dehydration, which in turn can decrease blood flow to the kidneys and lead to kidney damage. It's a delicate balance, managing enough fluid to relieve the body of excess while not depleting it so much that it harms the kidneys. For those on diuretics, it's critical to manage fluid intake carefully and monitor kidney function regularly. Your doctor might adjust your dosage based on how well your kidneys are handling the medication and whether your body is maintaining a healthy fluid balance. As we wrap up this first part of our journey into understanding how medications affect kidney health, remember that knowledge is power. By understanding the risks associated with these common medications and taking proactive steps to manage these risks, you can help ensure your kidneys continue to perform their vital functions, keeping your body in balance and your health in check. Stay tuned as we continue to explore more about how other medications interact with our kidney function and how we can navigate these waters safely, continuing our exploration of how medications can impact kidney health. We delve into the world of proton pump inhibitors, PPIs, a class of drugs commonly prescribed to reduce stomach acid and treat conditions like gastroesophageal reflux disease, GERD. PPIs, including popular choices like omeprazole, pantoprazole, and esomeprazole, are highly effective in providing relief from heartburn and acid reflux. However, their impact on kidney health is less widely understood and can be quite concerning. PPIs can contribute to kidney problems over time, particularly with long-term use. The mechanism is often insidious, as these drugs can cause acute interstitial nephritis, an inflammatory condition affecting the kidneys that can lead to reduced kidney function and, in severe cases, chronic kidney disease. The problem often lies not in short-term use, but in the prolonged reliance on these medications without adequate monitoring. For those who use Type B PPIs, it's crucial to reevaluate their necessity regularly. Many patients continue these drugs for years without a second thought, unaware of the potential renal risks. Lifestyle changes, such as adjusting diet, reducing meal sizes, and avoiding late-night eating, can significantly mitigate acid reflux symptoms and reduce reliance on PPIs. Elevating the head of the bed and avoiding foods that trigger reflux, like spicy foods, chocolate, caffeine, and acidic fruits, can also be effective. Switching gears, let's consider ACE inhibitors, a class of drugs used widely to manage hypertension and heart failure. ACE inhibitors, including lisinopril, enalapril, and ramipril, work by blocking the production of angiotensin II, a substance that narrows blood vessels. While they are effective in improving blood flow and reducing blood pressure, their impact on kidney function is a double-edged sword. On one hand, ACE inhibitors can protect kidney function in patients with diabetes or mild to moderate kidney disease by reducing proteinuria and slowing disease progression. However, they can also decrease the glomerular filtration rate, GFR, a measure of kidney function in certain scenarios, particularly in patients who are dehydrated or have significant renal artery stenosis. This can lead to a paradoxical decline in kidney health, especially if not closely monitored. Patients on ACE inhibitors should have their kidney function and electrolytes monitored regularly, especially when starting therapy or increasing doses. Adjustments might be needed based on individual responses to ensure that the benefits to heart and blood pressure management are balanced with safe kidney function. Antiviral drugs also warrant a discussion in the context of kidney health. Medications like acyclovir, used to treat viral infections such as herpes simplex, and remdesivir, used in the treatment of COVID-19, can cause kidney issues. These drugs can lead to crystal nephropathy, where crystals form in the kidneys and cause damage. This is particularly common with acyclovir and can lead to acute kidney injury if the kidneys are overwhelmed with crystalline deposits. For those on antiviral therapies, staying hydrated is key. Adequate fluid intake helps prevent the formation of crystals by diluting the urine and ensuring that drugs and their metabolites are flushed out effectively. Regular kidney function monitoring is also essential, particularly for those with existing kidney impairment or those on long-term antiviral therapy. Understanding the impacts of these medications is not just about avoiding them, but about using them wisely and in ways that minimize risk. This is especially important for those with existing kidney issues or other risk factors such as diabetes or hypertension, which already place an added strain on the kidneys. In sum, while medications like PPIs, ACE inhibitors, and antivirals are indispensable tools in managing various health conditions, their use must be accompanied by careful consideration of their renal impacts. Regular consultations with healthcare providers, tailored treatment plans, and lifestyle adjustments play critical roles in mitigating these risks, ensuring that the benefits of these medications are realized without compromising kidney health. This careful balance allows individuals to maintain both their systemic health and the integrity of their kidney function. As we continue to navigate the complex relationship between medication and kidney health, it becomes apparent that vigilance and proactive management are crucial. This understanding brings us to another significant category of medications: lithium and antiviral drugs, each with unique impacts on renal health. These insights can empower us to make informed decisions, ensuring that while we treat one aspect of our health, we do not inadvertently compromise another. Lithium has been a mainstay in the treatment of bipolar disorder for decades, offering stability to those grappling with the highs and lows of this condition. However, its use comes with a notable downside for kidney health. Chronic use of lithium can lead to nephrogenic diabetes insipidus, a condition where the kidneys are unable to concentrate urine properly. This leads to frequent urination and an increased risk of dehydration, which, if persistent, can cause chronic kidney damage. Over time, this can evolve into more severe forms of kidney disease, potentially culminating in end-stage renal disease, which would require dialysis or a kidney transplant for survival. The key to using lithium safely is regular monitoring. Kidney function tests, including serum creatinine and electrolyte levels, along with urine tests, should be part of routine care for anyone on long-term lithium therapy. If signs of kidney strain are detected, adjustments in dosage or even a shift to alternative mood stabilizers with a more favorable renal profile might be necessary. Patients should also be educated about the importance of adequate hydration and the potential renal risks associated with their treatment. On the antiviral front, the development of new drugs has surged in response to global health crises, such as the COVID-19 pandemic. These drugs, including remdesivir and others used to treat viral hepatitis and HIV, play a critical role in managing infections. Yet, their rapid deployment brings to light concerns regarding their long-term effects on kidney health. For instance, drugs like remdesivir have been associated with acute kidney injury, particularly in patients who are already critically ill. This injury is often due to the drug's impact on kidney cells and its potential to cause tubular necrosis, where kidney cells die due to toxin accumulation. Hydration, once again, plays a critical role in mitigating these risks. Ensuring that patients receiving antiviral therapies are well hydrated can help minimize the concentration of these drugs in the kidneys, reducing the risk of crystal formation and other toxic effects. Regular monitoring of kidney function is indispensable, especially for those with pre-existing kidney conditions or those receiving drugs known for their nephrotoxic potential. Emerging treatments and the ongoing development of new antiviral drugs necessitate a careful approach to their use. Balancing their undeniable benefits in treating life-threatening infections with the need to preserve kidney function is a delicate task. This requires ongoing research, patient education, and careful clinical management, ensuring that these powerful tools do not become a double-edged sword for renal health. Now, stepping beyond individual drugs and their effects, it's crucial to address the broader scope of medication management in preserving kidney health. This involves not only staying informed about the potential renal effects of medications, but also adopting lifestyle changes that support kidney health. For example, maintaining a balanced diet, low in sodium and rich in fruits and vegetables, can help manage blood pressure and reduce kidney strain. Regular exercise and avoiding smoking can also enhance cardiovascular health, which in turn supports renal function. Moreover, it's vital for patients and healthcare providers to engage in open dialogue about all the medications being taken, including over-the-counter drugs, supplements, and herbal remedies. Many of these can interact with prescription medications and affect kidney health. A comprehensive approach to medication management can help prevent adverse interactions and ensure that each patient's regimen is tailored to their specific health needs, maximizing benefits while minimizing risks. Lastly, awareness and education about the signs of kidney damage and the importance of regular monitoring cannot be overstated. Symptoms such as swelling in the legs, changes in urine output, fatigue, and nausea should prompt immediate medical consultation. Early detection of kidney issues can lead to interventions that significantly alter the course of kidney disease and improve long-term health outcomes. In conclusion, while medications are essential tools in the management of various health conditions, their use must be balanced with careful consideration for kidney health. Through informed decision-making, regular monitoring, and proactive lifestyle choices, we can safeguard our kidneys while effectively managing our overall health. This comprehensive approach ensures that our treatment plans do more good than harm, allowing us to enjoy a healthier life with well-functioning kidneys.